Sensationally silver, because you are.
Welcome, everyone, to Sensationally Silver, A State of Mind, conversations with extraordinary, ordinary persons of age, people who are going to bring you information, inspiration, and validation. Join us. Hi, everybody. Welcome to Sensationally Silver, A State of Mind, conversations with extraordinary, ordinary persons of age, people who have something very valuable to communicate to you, but aren't worldwide celebrities. And my guest today is Dr. Lorie Robinson. She is a podiatrist, and she has some things to tell us about taking care of our feet as we get older. I'm assuming, Dr. Robinson, that there are some things that are rather unique for persons of age. Is that correct?
That is correct. But it applies to everybody. The things I'm going to say really applies to all my patients, because eventually, hopefully, even young people will get old. So it carries through for everyone.
You know, that's a funny point, because when we're young, we don't want to think about getting old, and we certainly don't identify with older people. There's almost a built-in aversion to the whole idea of aging, but that is a victory if we get to live long enough to be a person of age. Yeah. So
frankly, I just want to interject. I tell my children who are adult age, I give them advice all the time. And I tell them, people pay for my advice and you're getting it for free.
Yeah, I know. I guess we have to kind of pick our audience, because it's not always something that people want to hear from older people.
Exactly. Especially your mother.
Yeah, especially. But they think it's going to be different. I know I did. I was going to do everything differently from what my parents did. And of course, some of it was different, and a great deal of it was just the same. So anyway, let's get into feet. What do we need to know?
Well, the first thing and the most simple, basic thing that will help you, or even young people, but our feet were not designed to walk barefoot on hardwood floors or bathroom tile or kitchen tile. Our feet were designed to walk on earth, sand, grass, dirt, mud. And if we were still walking on earth, the earth would be our shoe. The earth would come up and be the perfect shoe for everyone, no matter how big or small or high or low your arch is. But because we're not walking on earth anymore, we are walking on hard surfaces, and these surfaces cannot come up to our arch. And what ends up happening is our arch ends up sagging down to the weight-bearing surface. And the easiest thing to do to prevent problems related to this is to slip into shoes before we even stand in the morning. And bedroom slippers will not support our body weight, so not a bedroom slipper. But the nice thing now is various shoe brands like Skechers and Orthofeet. So many shoes now are slip-in, and they're as easy to use as bedroom slippers. And if we slip into these shoes before we are even weight-bearing, before we stand, even in the middle of the night if we have to get up, that will prevent so many problems that I see in my practice.
So what are some of those problems that you see that maybe due to not having that earth support for that?
So many problems. First of all, plantar fasciitis, which is really heel pain, because when you don't have a shoe on in the morning, the soft tissues on the bottom of your feet bowstring and pull, and they separate from the heel, and that is plantar fasciitis. And to avoid that, if you slip into a shoe right out of bed in the morning, preferably a shoe that has a slight amount of elevation and back, because that shortens your foot and keeps that fascia from bowstringing. You're going to avoid that tear, which is plantar fasciitis. And I see 5 to 10 people a day in my practice with plantar fasciitis, with heel pain. And most people will have heel pain, at some point in their life. And if you just put a shoe on and not stand barefoot, you can really avoid that particular problem.
So maybe somebody who's watching or listening is thinking, well, I don't step onto a hard surface. I step onto my nice thick carpet.
Well, underneath that nice thick carpet is a hard floor. So even a nice thick carpet doesn't compensate for putting a shoe on in the morning.
It doesn't give enough support.
No, it doesn't. No,
Okay.
because underneath the carpet, it's hard.
Okay. So there's not a giving.
Exactly. The other thing that definitely older people get, if they're walking around without adequate support, are stress fractures in their feet. And I see that pretty frequently. And that's not a fracture related to dropping a brick on your foot. That's just what happens when the bones crack. Your metatarsal bones do not lay flat in your shoe. They're angled. And if they're not supported from underneath, when you're walking, and especially after menopause or with any kind of osteopenia or osteoporosis, those bones just can crack, just getting up and walking to the bathroom. And I see stress fractures many a week in my practice. And again, putting a shoe on first thing in the morning that has adequate support before you stand can avoid that. It can reduce the probability of that happening.
So we're really just basically talking about prevention here for things that we become more likely to have happen to us.
Exactly. Arthritis is another thing. If our foot has full contact with the weight-bearing surface, like they would if we were still walking on earth, if we can replicate that with the shoe and have full contact so that there's no gapping between your foot and the weight-bearing surface, then you can avoid even arthritis, because arthritis happens when those bones shift. And I want to show you the bones in the feet. I don't know. Can you see this? Can you see the bone?
Yeah, a little higher. Just there we go. Okay.
The bones? Okay. The bones in the feet are like a jigsaw puzzle. You can see this. There are 26 bones, actually 28, including the bones that lie in a tendon underneath the first metatarsal, but there are 26 bones here. When you step on this this is like a jigsaw puzzle. And when you walk around on your foot without full support, the puzzle comes apart. And that's where you start seeing arthritis. The bones start shifting, and you get pain when that happens. If we can keep the puzzle together, then you're going to have less pain and less probability of stress fracture, arthritis, and deformity, like bunions and hammer toes even. So just simply wearing a shoe in the morning can avoid so many of things that I see daily in my practice.
You've answered a puzzle for me, because I've heard from you before, because I know you, that we need to wear shoes that are support. And I've been thinking, but with people who live closer to nature than most of us do, why don't they have these kinds of problems? But you're explaining it because they're walking barefoot on that earth, and we're not.
That's right. So the earth is their shoe.
Yeah. Okay.
That's their shoe, and it's a perfect fit.
Okay.
So that's the thing. And the nice thing, I mean, really over the past 4 or 5 years, we now have slip-in shoes, which are so easy. The Skechers slip-ins, Ortho feet, there are so many brands now that are slip-ins. So they're as easy to use as a bedroom slipper, but provide more support. And we don't want to get a shoe that's totally flat on the bottom, because our foot isn't flat on the bottom. It has a shape. So we want to get a shoe where the heel is somewhat higher, not high heels, but somewhat higher than the rest of the foot. That kind of shortens the foot, and it's going to keep the puzzle together. The flatter the shoe, the more your foot's going to sag and develop these problems that I've just mentioned. So that's the easiest and simplest and first thing that people can do to help their feet.
What about high heels? And I'm just going to tell a little story, which I find very amusing because I'm this kind of person. This was a podiatrist I knew many years ago, and he was talking to me about someone whom he said to stop wearing high heels because it was terrible for her. And she said, "Oh, but I'm going to a wedding." And I had to laugh because I know exactly how she felt. I mean, who cares about the pain? I have to look good for this event. What about high heels? Occasional use, never, never, never. What's your advice?
I think high heels are better than ballet flats. I'd rather see somebody in high heels than a ballet flat. And for an event, I mean, I'm a woman. I can't say my feet have never hurt in a pair of shoes. But yeah, for an event, there's no problem with that. And high heels can be okay. I mean, as long as they're not 4-inch heels. But if you have a heel that's 1.5 or 2 inches, sometimes, especially for plantar fasciitis and for conditions where we don't want that fascia to sag and bowstring, sometimes a 1 or 2-inch heel is better than an orthopedic boot to treat those problems. So I don't have a problem with high heels. If somebody comes in with ballet flats, the flats that are like almost worse than walking barefoot, those to me are worse than heels. So
it sounds like there's an upper limit, though. You don't want to get into the ridiculously high.
You can injure yourself if they're really high and you're walking, especially on an uneven surface. I mean, you can twist your ankle, so you really can hurt yourself if they're ridiculously high.
Okay. I mean, once upon a time, I didn't think 3-inch heels were ridiculously high at all, but they might be a little dangerous at this point.
Well, 3-inch heels, I'm talking about, the stilettos or 4-inch heels, those are pretty high. And I think you have to be pretty agile and have pretty good balance. I mean, and also the other thing is if your foot is short, I have a short foot, a 4-inch heel on my foot is different than a 4-inch heel on a woman who has a size 10, because that slope is different. So if you have short feet, if you're short, size 6 or 7, a really high heel is different than if you're an 8 or a 9.
So you're saying that it's a little easier on your foot if you're taller? Is that correct?
Well, if you have a longer foot.
A longer foot.
It's just algebra.
Okay.
Yeah, if you have a longer foot, then, a heel is not the same. It's different if your foot's shorter. The slope is different. So
now, Dr. Robinson, does the fact that you have short feet have anything to do with you becoming a podiatrist? Was there a personal interest? So what's that story?
Well, that story is I met a young man that I was crazy about back, God, at least probably, well, I won't say how many years ago, but many years ago. And he happened to be in podiatry school. So I thought, that sounds like a good idea. So I followed him to podiatry school. And the young man is no longer in my life, but I've been a podiatrist. In June, it'll be 45 years since I've completed my residency. So this was just a coincidence, serendipity, just something that happened in my life that really framed my life and really has defined me through thick and thin. It's always been there. It's been the constant in my life.
It sounds to me like you enjoy what you do. Am I right?
I continue to. It gives me so much. And many people my age, my friends are retired and they do volunteer work. And I think, what could I possibly volunteer for that's more useful than what I do? And it gives me so much, Robin. It's frankly, it's my therapy.
Mm. I understand that one. Yeah.
Yeah.
When we're walking down the path that suits us so well, it does. It just feeds our heart. And the feeling that we're doing something that's of service to others feels terrific too.
It does, for sure.
Can you tell us maybe a story or two about someone who's been helped so much by podiatry that maybe didn't even know that was what was going on or the problem, or just some wonderful story about somebody recovering from, I'm sure it's always pain.
It's every day I hear those stories. The nice thing about what I do is that people really do come in with pain, and they're so appreciative of the service that we can provide. Patients with ulcers that we're able to close, patients with bunion deformities that I'm able to correct. Even something simple, just like a painful callus that prevents you from taking a walk or just doing regular things where you're not doing the things that you want to do. We can fix these things, and it can be something simple or something more complicated, but every day it's really an opportunity to improve people's lives and how they feel. And they are extremely appreciative, which gives so much to me.
I remember my grandmother would see someone who helped her take care of her feet, but people walked a lot more when my grandmother was around. We don't walk like we used to. And I'm wondering if there are people who don't even really know that podiatry exists. Is that possible?
Well, in the community in Santa Barbara, I think, most people do know podiatry exists. First of all, I mean, it's relatively affluent, but then there is Sansom also that serves everyone in the community. And we have a very diverse ethnic community here. A lot of people do have diabetes, type 2 diabetes, type 1, type 2 diabetes. So most people who see a primary care physician for any reason will be referred to a podiatrist if they have foot problems like diabetic neuropathy or diabetic ulcers or circulation problems, or again, just painful hammer toes or painful lesions on their feet or athlete's foot or fungus nails. There's such a variety of things that podiatrists treat and we encourage people to walk because we know that walking will increase our lifespan. And we don't have to be, we don't have to play tennis or do extreme athletes. Don't have to be runners at this point. But walking, we all need to walk to stay healthy. And that's what my job is not to tell you, you can't do this, you can't do this, you shouldn't walk. My job is to make sure your feet are feeling well so that you can walk, because we know that helps your heart, your lungs, your emotional well-being. So,
And it's not going to feel good to walk if your feet hurt.
right,
So we
exactly,
want to feel comfortable, and then we can enjoy this perfect exercise of walking.
exactly.
Right. Okay. Any other things that are particularly common or relevant for persons of age? Any other?
Sure. Well, I'd like to say that foot hygiene is important. And we know when we go to the dentist, we're told to use dental floss to make sure that we clean in between our teeth. Well, the same thing applies to feet. I mean, taking a shower and whatever water happens to land on our feet, that generally isn't going to clean your feet well enough, especially in between your toes. So I recommend running a washcloth in between your toes, just like you would use dental floss in between your teeth, but not do it in the shower if you're a fall risk, because you don't want to, bend over and try and do this standing in the shower if you're not stable or don't have good balance. But at least 3 times a week, every other day at least, you should run a washcloth, soapy washcloth in between your toes, and then rinse well, and then run a dry washcloth in between your toes to dry, and even a hair dryer after that, because you don't want to put socks on your feet if they're still moist. You want to just use a blow dryer and make sure your feet are dry and clean before you put socks on. So that's something that's really important, I think, because your feet, if they're not clean in between your toes, you can get fungus, you can get ulcers, your toes become macerated and moist. And it's simple to avoid that.
Is it possible that people can have athlete's foot and not even know it?
Yes, it is. Because there's a dry form of athlete's foot that people think is just dry skin, but it usually has a fungal component. But the good news about any kind of athlete's foot on your skin is it can be treated topically, because your skin replaces itself about every 4 to 6 weeks. The lower layer of the skin eventually sloughs off. So fungus on your skin can be treated topically, whereas nail fungus cannot really be treated topically. It doesn't respond to topical treatment or laser. But in terms of nail fungus, that's another thing that I frequently see on older people and even younger people. Is it's not unlike what you hear on TV, that this is a serious infection and it has to be treated and it can make you sick. That really isn't true. The fungus that I see on nails is not usually harmful. It's not contagious. It doesn't become internal or make you sick, which is why it's so hard to fight, because it's not life-threatening and your immune system doesn't fight it. So it's very hard to get rid of, but it's relatively harmless. And topical treatments do not work because the fungus is in the nail matrix, which really isn't exposed. And so expensive treatments like laser, none of those things really work. The only thing that really can treat nail fungus are oral medications, which are potentially harmful. They have side effects. So for older people to use medication with potential side effects for a condition that's relatively harmless is not really necessary.
Okay.
That being said, the fungus nails can be debrided and treated so they're much thinner and much easier to cope with. And women can use nail polish over them to hide them, but it's topical treatments are just not effective for nail fungus.
Okay, but it is fairly unsightly. If I'm thinking of the,
It can be. It
yeah.
can be, but the podiatrist can. In my office, what we do for really thick nails is we thin them out. I personally don't use a rotary thinner because I don't want that fungus all over the room. I don't want to breathe it. I don't want my patients to breathe it. But I just take a sharp instrument and scrape it off. And so I can get the nails pretty thin, especially a woman where you could put polish over them, and honestly, people wouldn't even know. But I dissuade people, especially if they're on other medications, from using oral medication because there are side effects. These medications are metabolized by the liver, and we have to do blood profile tests every 30 days if patients are on these medications. So I don't, it just, it doesn't seem like a good idea to use these. And once you're off of the medication, the fungus can come back. It's frequently hereditary, more so than contagious.
Oh, that's interesting.
Yes. Some people are just predisposed to fungal infections on their feet, both skin and nails. And many, many years ago, when we were first in practice, many years ago, 45 years ago, we didn't even wear gloves treating people. And we didn't get fungus on our hands. It's not contagious.
That's interesting. So,
Yeah,
like so many other things, there's a genetic component to the
right. Exactly.
tendency to succumb to that. All right.
Exactly.
Okay. All right. Anything else that we need to know about feet?
Yeah, let me things that I see all the time. Uh Ingrown toenails, of course, is something else that I see and treat regularly. Um Having proper nail care. Uh If your nails are easy to cut and you don't have any neuropathy or poor circulation, then usually you can do it yourself or have someone else do it for you. But if you have neuropathy or if your circulation is poor, it's good to have a professional trim your nails to avoid ingrown toenails. Um, Also, genetically, as we age, sometimes the nails change and they don't lay flat any longer on the nail bed. They become more convex, and those corners can dig in. And if the corner of the nail actually penetrates the skin, you can get an infection that has to be treated. But these things can be prevented from just proper trimming of nails. And sometimes we do procedures called partial matrixectomies, where a chronically ingrown nail, just the edge can be removed permanently so that it never comes back. And that's an office procedure, and it's very effective.
That must be very relieving because ingrown toenails hurt a
Right.
lot.
They,
Yeah.
they do.
All right. Well, we're kind of running out of time here, and I want to get just for a moment to a more personal level with you, Dr. Robinson. Um, what are you looking forward to next in your life?
Well, I paint a lot. I'm an artist. I belong to the Santa Barbara Art Association. I exhibit locally sometimes and occasionally out of state. So I do paint, and I paint frequently. And when I retire, I'm sure I will make that more of a full-time avocation. But I'm not looking forward to retiring until my eyesight changes or my hands shake. As long as I can continue providing this gives me as much pleasure as anything I do.
Okay. Well, I love hearing that.
traveling is also very wonderful. I do enjoy traveling.
And I imagine if you take your paints with you,
I do.
that you get to paint these beautiful new
I do.
examples of scenery and then take them home with you.
I do. I definitely have. My computer is full of more images than I will have time to paint in my lifetime. But yes, I do enjoy that a lot.
So, since we need to stop, what would you say to persons of age who have been with us today? What's your message for them?
My message is to make sure you put shoes on in the morning. That's very important. And to walk, because I see patients do a lot of funny things with their feet. They write the alphabet with their feet. They do all sorts of things. Just walking exercises every muscle in your foot, every tendon. It helps your feet. You don't have to do anything exotic other than walk. And don't put off doing things you want to do. Just there's no time like the present.
So true. Thank you, Dr. Robinson,
You're
for being our
welcome.
guest today.
You're
You've given us a
welcome.
lot of really good and practical and helpful information. And thank you to everybody who's joined us today. We'll see you next time.
Thank you. Bye-bye.
Bye. Sensationally Silver, A State of Mind, is sponsored by Sensationally Silver, a complete hair care product line created especially for people with hair like ours, naturally gray and white hair. Sensationally Silver products can be found exclusively at sensationallysilver.com.
Sensationally silver, because you are.